There, that might be better.
All right, so I just started recording. We're going to get started in a couple minutes. So if you have not changed your name to your full name, please do so now. Like Jennifer said, you're going to find your little box up top and click the 3 little dots and put change name or edit name. And about halfway through, if that's not done, I will privately message you. And then when Jennifer is done recording, I will send the link to the survey, and that will also count as your attendance. So also make sure that you are muted, and then we can get started whenever Jennifer's ready.
All right, so let's see. I see Justina here. Give it 2 more minutes. See if anyone comes in, Justina.
Yes, you should be filling out the survey after every session.
And now you don't have to do it immediately after every session. That's just for the CEs, so you can do it as long as you do it before April 19th. So just remember which ones you went to. But if you fill it out after April 19th, we might not have time to get you the CEs in time, the CE certificates rather. All right, Justina, you're going to do the screen share, right? So maybe you can get that ready before we begin.
Can you see my screen?
I can.
Okay, hang on a second. Why is this not working? There we go.
And I'm trying to monitor the chat box too. No, the CEs are for anyone. If you need NBCC approved CEs, it's for any student, any counseling professional.
Okay. Do you want me to start, Jen?
Yeah.
Okay. So, I guess you can introduce yourself first because you're listed first.
All right, so thank you guys. So this is trauma and I am a student at the Chicago School, and bad joke, but I'm attached to attachment. I think it's really an interesting topic, and also trauma. Justina and I are kind of drawn to trauma. I think a lot of counselors, you know, either shy away from that topic or are drawn to it for whatever reason. But I think that there's a bit of a lack of information about how trauma impacts attachment throughout the lifespan. So that's why we created this particular presentation with Dr. James Devlin, who I'm not sure is able to make it today. I'll let Justina introduce herself.
So like Jen, I'm also a graduate student at the Chicago School. I'm almost done, hopefully, fingers crossed. And like she was saying, like we're pretty drawn to trauma. I've noticed that a lot of the presentations and manuscripts that I worked on are trauma related, only because I think as counselors and training, like we see that a lot in our work because we're both currently in field work right now. Let me see.
And this presentation.
Jen?
I can see. Okay, you want to do the intro slide?
Yeah. So I have a question for everyone, just so I'm not reading off the slide. Why does everyone think that it's important to like look at trauma and attachment throughout the lifespan? And Jen, can you monitor the chat because I can't see it with my slide?
I can. Am I frozen still?
No, I can hear you.
Okay, good. So Nicole said it impacts clients' worldview, attachment considerations, even with the counselor. What a great consideration. And it's an indicator of where people are in life. Ooh, so many people replying.
Yeah, there's a lot.
So I'm loving these neuronal networking, network mapping, suggest implications for life experiences. Absolutely, we're going to get into all of that. It fluctuates. It carries over well into adulthood. It impacts all relationships. Trauma and ACEs impact the health and experience the person has as they grow older.
Were you able to get all of them?
And so much more. Yes, all those things.
Yeah, you're getting a lot. All right. So the reason why we are doing this presentation, and we actually did this as a manuscript, so we're kind of translating it into a presentation. So trauma, unfortunately, affects a lot of children, and a lot of adults who have experienced trauma have also experienced trauma as a child. And when you experience trauma as a child and then you re-experience that as an adult, sometimes those are the individuals who have a hard time managing their symptoms that are related to trauma because they've already been traumatized, like since they were children. So the reason we're doing this presentation is so that we understand the mental and behavioral health symptoms, and also understanding how family plays a role, because that, like, your family of origin plays a huge role in terms of coping skills, in terms of trauma, culture, all of that plays a big role. Shaping the clinician's therapeutic response. So also understanding how our experiences in life impact our clients and understanding our cultural values and beliefs. And then intervention and prevention for high-risk families. So for certain cultures and certain socioeconomic statuses and different things like that, certain families are at higher risk for trauma than other families, and that's important to consider as well. So one of the most important things about trauma is to know that individuals might not show any signs of trauma or having experienced trauma until many years later. And I can definitely attest to this, being that I do come from a Chinese culture, that I experienced trauma as a child, but I also experienced it as an adult. And when I experienced it as an adult, I didn't really, I couldn't fully comprehend that what I was experiencing was a traumatic event. And what I did was I suppressed all of it. And I think it took me about maybe 8 to 9 years to really be able to tell anyone. And after I told someone about it, I kind of thought to myself, why did it take you so long to do that? But that's just kind of, how it works, because you might look at me and think oh, she's never experienced trauma, or she's never experienced this, and you never know. And that's the same thing with your clients, because even though they're not really showing any signs of having experienced it, doesn't mean that they haven't experienced any type of trauma. So the 3 types of trauma are physical, emotional, and sexual. And any type of trauma can leave devastating effects for anyone. So physical trauma includes physical abuse, experiencing a car accident or life-threatening illness, maybe something like what we're experiencing right now with the COVID-19, and then physical assault, natural disasters, terrorism, experiencing being in a refugee camp, war experiences, or experiencing community or school violence. And in terms of physical trauma specifically, usually within the first 8 years of life, if you've experienced trauma, that trauma tends to resurface throughout the rest of your life at different points. And in terms of someone who's experienced physical abuse, so let's say the example that we have is someone who has experienced physical abuse at age 4, may be more likely to develop post-traumatic stress disorder if they were in a car accident as an adult, or if maybe they joined the military and served in combat. Emotional abuse, I like to say this one is very tricky, and it's also very dangerous, because usually for physical abuse and sexual abuse, it can be seen for the most part, but for emotional abuse, it's unseen. So, you know, when you look at someone, you don't really know that they're experiencing emotional abuse unless they tell you that they are, if they're not showing actual signs of it, or if they don't show signs of maybe that they're having problems coping with whatever it is that they're going through. And emotional trauma includes psychological trauma, witnessing domestic violence, neglect, living far away from parents or family, having a parent who is sick or injured, grief and loss, military deployments, experiencing parental divorce, and experiencing the loss of a loved one. And it's important to highlight that children who experience emotional trauma often have like severe difficulty regulating their emotions and building healthy attachments later on in life, because they don't know the difference between what's a healthy relationship and attachment and what's unhealthy. And then children are also very likely to get autoimmune disorders or diabetes as adults if they've experienced neglect as children. And I thought this was really interesting, because when I read this particular manuscript, I was like, hey, that's me, because I do experience a lot of immune system issues, and I have a lot of allergies, and I did experience neglect as a child, but I would never connect the two together if I hadn't read this research article. So sexual trauma includes sexual assault, sexual abuse, and sexual exploitation. And over 70% of individuals who have been sexually abused, who sexually abused children, have experienced sexual abuse when they were children. So it's kind of like the cycle repeats itself. And children who experience sexual assault in early childhood are definitely at higher risk to be building those incongruent and inappropriate relationships later on in life, because like I said earlier, they don't know the difference between a healthy relationship and an unhealthy relationship. And I thought it was really interesting that a single sexual abuse experience as a child is equivalent to experiencing a lifetime of chronic stress, and that also leads to higher risks of experiencing physical health issues later on in life. Jen, you want to take it away?
All right, I'm going to take it away. So let's talk about attachment. The ability to form healthy attachments is essential. It is essential to one's mental health and social adaptation. And when we talk about childhood attachment, that really refers to that deep, enduring connection between the child and the caregiver. It's established in the child's first few years of life. So it's usually the mother, not always. The attachment between the child and caregiver, it does appear to be an innate need, and it influences nearly every component of the developing child's life. Like we kind of talked about in the comments in the beginning, emotionally, cognitively, behaviorally, this attachment is essential. And then also, like people were saying in the chat, and we'll get into later, the childhood attachment impacts children later in life. It's shown to influence the type of partners they choose, the way they act in relationships, and even how they attach to their own children. So, for example, children without secure attachments, they may grow up similarly incapable of establishing a secure attachment with their own children. I can go to the next one. Okay, Bowlby. So if you're a counselor, if you're in the counseling field in any way, you've heard of this name, John Bowlby. John Bowlby is credited with really recognizing the significance of early attachments, right? And he pioneered work in attachment theory. Bowlby is who we think of with the rhesus monkey. And he really conceptualized attachment as this behavioral system. It motivates infants, whether human or animal, to seek proximity to caregivers in times of distress. And the goal is security and survival. So Bowlby identified 4 types of attachment in children. 2 forms were insecure attachment, that was ambivalent and avoidant, secure attachment, and disorganized attachment. So you might remember from your undergrad or graduate psychology program the difference between all of these. But securely attached infants, they showed distress upon separation from their caregivers, but they were easily comforted when the caregiver returned. Ambivalent or anxious resistant infants, they showed greater distress upon separation, and upon the caregiver's return, they seemed to both seek comfort and attempt to punish the parent for leaving. So that's where you get that anxious, resistant, ambivalent attachment. And infants with the avoidant attachment, they showed minimal or no distress when their caregiver left, and when their caregiver returned, they either ignored or avoided the caregiver. The disorganized attachment, that was added in later years, and that kind of refers to no real predictable pattern of attachment behavior. So it says at the bottom, responsive parenting or fulfillment of needs, whether that's food or comfort, that's thought to lead to a secure attachment, and frightened or frightening parenting experiences that fail to meet the child's needs, that leads to insecure attachment. Go to the next one, Justina. And I can't always see what's in the chat, so I like my presentations to be interactive. If you have something, you can come off mute and add something, or Justina or Hannah can maybe read it during it if you think it's something that we should address during. So let's talk about the impact of attachment theory. So early attachment relationships, they provide children with internal working models of emotional communication. This shapes the way that children relate to others. They provide children with either the belief that they're worthy of love, I can trust other people, or I'm unlovable and the world is unpredictable, I cannot trust the world. So these core elements of the infant attachment relationship, they're incorporated into relationships throughout life. Their relationships with their peers, their relationships with romantic partners as an adolescent and as an adult. Adult attachment theory. Okay, so let's talk about this for a minute. So I want, we have a lot of people in here. We hear a whole lot about childhood attachment, right? With Bowlby and these 4 styles. Is anyone very familiar with adult attachment? And extra credit, does anyone know their attachment style as an adult? Put it in the chat box, or jump on in. Carrie said I was avoidant, but have moved into secure. Some have no clue. Secure, anxious. And yeah, like Michael said, Michael said, I know more about child than adult attachment, and that seems to be the case. Because childhood attachment theory has been around for a while. Adult attachment is kind of an evolution of Bowlby's attachment theory. I'm dismissive avoidant, so yay for me. But hopefully working towards secure. There's so many self-tests online. I don't trust all of them, but there are some good ones. And really, it's how you. It comes down to just how you react to separation, whether you fear it, whether you kind of want more space between you and another person. It's really fascinating. So this adult attachment theory, Bowlby's Bowlby's theory has just continued to evolve, like I said, in response to new research. So while Bowlby said human infants are born with attachment behaviors that are designed to assure proximity to this protective attachment figure, these infants, usually the parents, they occupy that role of the attachment figure. They provide food, they provide actual survival needs, right? As children and adolescents and adults grow, these other relationship partners, they step into the role of the attachment figure, and they provide the individual with safety or support. So adult attachment theory, it integrates the early attachment styles with adult relational patterns. And it places adults in one of three categories: anxious, avoidant, and secure. Anxious attachment in adulthood is characterized by the strong desire for closeness and protection, also intense worry about one's own value to the partner. An avoidant attachment is characterized by discomfort with closeness and a preference for emotional distance. While adults with this secure attachment, they're typically comfortable depending on others and being depended on. What else can I add on this? So at any stage of life, really, insecure attachment can have a negative impact on your personal growth, on your self-esteem, and on your attitudes towards others. Let's see what else. Oh, I can add more about this. Okay, I'm not even looking at it. So their attachment style can affect the functioning of your family, of parent-child relationships, of children's developmental outcomes. Like Justina and I said, this presentation came from an article that was in the Family Journal. So really it was intended for marriage and family therapists. And we focused on why is this important for marriage and family therapists to know. So for example, less securely attached individuals, they tend to be in more conflictual relationships, and they have less effective parent-child relationships. Children of parents who were less securely attached have been seen by kindergarten teachers as having externalizing or internalizing problems in school. Okay, I'll go to the next one. Okay, biological view of attachment. So this will be interesting to anybody who's into neurobiology. So I kind of touched on earlier that the people, human beings and animals, we have this innate biological drive to bond with others, right? So with infants, we said that their survival, it's dependent on eliciting responses from their caregivers. And in turn, the caregivers, moms, for example, they have hormones like oxytocin that drive them to bond with their infants. From a neurobiological standpoint, in the early years of life, this brain, it's developing, and its ability to organize neural systems, it's critically reliant on environmental cues from our caregivers. So when the caregivers attune to and appropriately respond to the child's physical and emotional states, this intersubjectivity in the brain occurs, right? So these interactions can create connections, shape circuitry in the limbic system. We know the limbic system plays a large role in processing social interactions and regulating our affective states and in coping with stress. So as a result, if you have insecure attachment styles, because of the way that it changes the brain, you may experience distress, confusion, avoidance with those to whom they're closest, and also difficulty just mirroring the emotional states of others. Okay, now let's get into the relationship between trauma and attachment. And Justina, if you want to jump in at any time too, because I feel like I'm hogging the slides here, but so trauma and attachment. So childhood trauma, it can have a profound impact on attachment behaviors. Traumatic experiences like the ones Justina talked about, abuse and neglect, they just rob children of the experience to develop a healthy attachment with their primary caregiver. In relationships and individuals' early attachments, they can predispose the person to either unconsciously seek out someone to repeat the same kind of attachment configurations in adulthood with the hope that these new experiences will be different. And I'm sure that you guys can can think of examples of that, whether it's in movies or TV shows, or maybe even in your own life of people, you know, I think someone in the chat box earlier mentioned that, you know, they try to relive that in their adult relationships, you know, so that they can try, maybe even unconsciously, to change it. For children who have experienced abuse from an attachment figure, they specifically might try to correct or reverse that experience by seeking out inappropriate close relationships with people who might not be safe. Okay, so that can lead to more traumatic experiences. And it can lead to difficulties, just difficulties in maltreatment. So they might be with a person who doesn't treat them right, or who rejects their expectations for closeness. Alternatively, children who've experienced abuse, they might generalize their experience of betrayal by one person to mean that no one's trustworthy. Okay, and then they don't trust anyone. Difficulties with relationships in general. And so Mike, I just saw Michael wrote in the comments, so how can trauma lead to more unsafe relationships? Yeah, so if you're abused as a child, you might want to correct that experience. Like, again, that can be unconscious. You might want to repeat that same kind of unhealthy attachment configuration by seeking out a close relationship with someone who isn't safe, maybe someone who's abusive. Good question. Thank you for asking. Go to the next slide. Okay, I don't know if this, I wanted to add a couple things. I don't know if it's on this slide or not. Stockholm Syndrome, we'll get to that. Yeah, okay, so because abused children have these disrupted attachments, they often concentrate on survival and self-preservation rather than on building relationships in more positive ways. So people with secure attachments, they're focused on the positive ways to build a relationship. But children who have been abused, they may focus just on survival. So Stockholm Syndrome, who has heard of this? Yeah, so it's also known as traumatic bonding. And you see it in movies. I don't know if it's always correctly demonstrated, but traumatic bonding really involves modeling of inappropriate behaviors and attachment dynamics, and the child bonding with the abusive parent just out of self-preservation. So this need for survival, the child might need to bond with the abusive parent, or as an adult, they might bond with the abusive partner out of self-preservation to prevent cognitive dissonance. So why am I staying with this person? Why am I in this home if it's bad? Maybe I need to think this is good in some way. The child may accept inaccurate explanations of the abuse, right? They might blame the other parent for causing the abuse to happen. They might say, well, you did nothing. You know, let me see, anything else on this slide? Oh, let's go to reactive attachment disorder for a minute. So for people who work with children, you may be familiar with RAD. And this is a great example of showing an actual childhood diagnosis that is thought to be caused by a disruption of the attachment relationship. A required diagnostic criteria for reactive attachment disorder is some level of neglect, abuse, repeated disruptions, or changes in the primary caregiver. And that just should show really how this abuse can cause an actual diagnostic mental illness. This isolation, lack of concern by caregivers is frequently seen in children with RAD. So I want to actually, before we go on, I want to hear, we have a lot of people in this room, and I presume that we have a lot of people who have worked with traumatized individuals. Is anyone willing to speak about maybe how they've noticed attachment issues, how they present in children who have been traumatized? What have you seen?
Hey, Jennifer, I don't have an experience on this, but I saw somebody ask a question earlier that I thought was really interesting, and they wanted to know what attachment style a child would be if their parent went to prison.
So that, it really depends on the child, right? So two people can go through the same exact traumatic event and respond to it completely differently. It depends on what supportive protective factors they have in their lives, or what factors might lead them towards having a more disorganized, insecure attachment. So if say one parent went to prison, but the other figure provided them with their needs, then that child could easily grow up with a secure attachment. Conversely, if neither parent was around, and the child viewed this incident as something uncontrollable, as the world just being something they can't trust, everyone I love gets taken away from me, then that child is going to probably develop an insecure attachment. So I don't think you can really generalize and say that everybody who goes through this type of trauma is going to have this type of attachment style. Justina, can you read what's in the chat box?
Sorry, I forgot to unmute myself. Let me see. So Ashley said, most of what I have seen with separation anxiety towards one parent after the other parent passed away. Kathy said, how are you defining primary caregiver in this world where the child spends half the week with one parent and half the week with the other? But that really does not matter, because 5 days out of 7 every week, they are at a daycare center 12 to 14 hours long a day. I am thinking about the high rate of turnover at many, many daycare centers.
So it depends what age we're talking about. So with infant attachment, again, it's usually the mother. The mother is usually the one that's feeding them, and that's the primary caregiver. However, we know that that's not always the case, and that there's a lot of situations where children spend half the week with one parent, half the week with the other. And could we say that that's a form of trauma? It certainly could be. It certainly could be if the child is not receiving a secure base, if they're not getting their needs met because they're shuffling back and forth. Although at the same time, maybe they're getting love at both households. Maybe they're getting all of their needs met just in two households, 2 Christmases, right? All right, what else do we have in here?
So Michael said that I am a school counselor looking to make the transition to clinical mental health counseling, and trauma was a major factor for other mental health issues, substance use, self-harm / suicidality, you name it. But I typically noticed that while students with trauma may have been reticent to form relationships with stable adults, they tended to really rely on them once they were formed.
Right, so that could be that anxious attachment configuration in adulthood, where maybe they really rely on them. Maybe they need that, and they think that their self-worth is tied to that relationship because of their traumatic experience. So there's the two types, where the one, they kind of overly attached to a romantic partner, or they shun away because they have been traumatized in some way in their youth, and they're not really sure of themselves, and they're not really sure what they're going to get. They're not really sure if they can trust this person, and they respond either by being too close or too distant. Not sure how many other slides we have, but we'll keep going, or people can jump in. Oh, okay, more biology for the biology lovers in here. So research has shown that the infant's interaction with caregivers, it shapes the formation and operation of the brain. We talked about that a while ago. However, the parts of the brain most affected by trauma and abuse, they're the parts of the brain that regulate self-control and the ability to cope with stress. Okay, so that makes it a little complicated, right? Because if you're traumatized, you need to regulate self-control and you need to cope with stress. And yet, if you're traumatized, the parts of your brain that are responsible for regulating those abilities are damaged. So, the ability to adaptively cope with stress, it's directly and significantly influenced by the infant's early interaction with their primary caregiver. So essentially, children need a secure attachment during the first 2 years of life. That's the time when the right hemisphere of the brain, that part that's responsible for processing social interactions, for regulating affective states, for coping with stress, it's undergoing its most major growth spurt. Overwhelming stress, trauma within early attachments, that just wreaks havoc on developing brains. Excessive amounts of neurons, they die. They literally die from pathways linking limbic circuits between these areas of the brain. That then leads to a cycle between hyperarousal and dissociation, and that can kill neurons in the hippocampus. So what does the hippocampus do? What's that responsible for? Someone put that in the chat, please. Memory. Yeah. Okay, so memory. So if you have an impaired hippocampus, you can't process traumatic memories into autobiographical narratives. So the memories remain unconscious in the limbic system, and that further triggers stress reactions. So that's why, we think sometimes about childhood trauma and its impact on memory. If too many neurons are lost, pervasive developmental effects occur. For that reason, attachment trauma, it's increasingly being known as developmental trauma because of how it changes the brains and how it changes our development. Go to the next one. We'll summarize and we'll take thoughts and questions, and we have so many people in here and so many people putting great things in the chat. I'll let Justina summarize.
So to kind of bring this presentation full circle, in terms of, attachment and all the things that we talked about today, attachment and trauma, they're really like intertwined very closely. And it's really important for us as counselors in training or licensed professional counselors to really understand the effect that trauma has. And I was reading the chat box earlier, and someone mentioned that they work in the substance abuse area and that all their clients experience trauma. So Jen and I actually both have experience working in the substance abuse area, and I don't know about her clients, but I live in California, and the clients that I've seen all have experienced severe trauma. And this is like being locked in your closet, being sprayed in the face with like Lysol, sexual abuse, things like that. And it's really important for us as counselors to know that these individuals that we're seeing in our offices, although they're using, heroin or meth or whatever the case may be, that at the end of the day, they're still human. And, they went through these experiences and they've experienced all these horrible things. And it's just kind of like, you have to ask yourself the question, like, if I were in their shoes, like, what would I be doing to cope with this? Because the trauma that they've experienced and the attachment styles that they have with their primary caregivers or whoever was in and out of their lives, that also has an effect on their coping mechanisms. Because if you like experience trauma and you have support, you're still able to cope with certain things. You have that support network. But for people who have no one, how do you expect them to cope? Does anyone have any questions or comments for us as we close this presentation? Let me stop sharing so I can actually see what people are saying.
Okay, so someone, Jessica said, the site where I do my internship is a recovery center. A lot of the clients have a lot of trauma. I think that regardless of the setting we work, we're going to come across clients that have experienced trauma, whether it's visible to us or not, and whether it's shared with us or not. Oh, did I miss a question from Chris? Okay, thank you for reposting it then. How do you see the attachment theory polarities from an individualistic versus collectivistic worldview? Do you think that it is coming from predominantly an individualistic perspective, or do you feel as though it takes a collective into consideration? Great question. So, our article and presentation has been focused on an individualistic society, because Justina, myself, and Dr. Devlin, we live in the United States. So we're coming at this from a certain viewpoint, and the cultural considerations, most of the research that we've used for this is very centered in the Western world, right? Studying, like most research studies, it's usually a certain demographic of people. So I think there needs to be more research in there. I'm curious if you have thoughts, if that question was asked because you have an opinion or an inkling about that.
You can just unmute yourself if you want to. Felicia, are you the F man? I got your name correct, right? I think you're in the substance abuse class. Okay.
Yeah, you're right.
Jen, do you want to take her question? Do you want me to answer it?
Where's the question? Hold on.
She's asking for advice.
What's the best advice you can give me when understanding their trauma in association with their addiction? You want to take it, Justina?
I would say that the best advice that I would give you is to see them as a person and a human being instead of someone who uses whatever drug it is that they use. Because, like, from my experience working in addiction, they've experienced that their entire lives. Like, every single person has treated them exactly the same way, and you can be that person to make that change. You can be the person to break that cycle if you really like, and it's going to be hard. I'm not going to lie about that. It is going to be very, very challenging sometimes because, you know, you're just like, if you just did this, then you would be able to do this and all these other things. But really, to really see them as a human being, that would probably be my best advice.
I mean, not for trauma work in general. You know, a lot of clinicians, we might be aware of how trauma impacts emotional and behavioral functioning, but we just can't ignore how childhood trauma disrupts the processes of attachment and trust building. So having this awareness of the relationship between trauma and attachment style, that can help you better understand, oh, now this makes more sense about why this person you know, gravitates towards these relationships. Oh, now this makes more sense about why this person treats their children this way. So it really has a lot of implications for understanding family and relational dynamics, and for shaping our response, our therapeutic response as clinicians. You know, it can help predict behaviors, and it can, you know, help us understand why these patterns might be difficult for our clients to break, because it's attachment patterns. You can't just expect somebody to, you know, change overnight, and if it's addiction or anything. But with attachment patterns, that's, you know, a style that they've had throughout their lifetime, and having that awareness can help you become a more informed and more empathetic counselor.
I read in some research a couple of weeks ago that also if like the families don't understand their addiction and they don't like participate in like their treatment, then it can give them a greater chance of relapse, because if they're like connected with their family a lot and they don't go through it with them, then it can really affect them in that way too.
So I want to speak to that a little bit, because I did work with a client who was from the same culture that I'm from, and she received what she perceived as a lot of family support from her parents and her siblings. But knowing what my cultural values are, and knowing that we really have kind of like a suck it up mentality, even though her like dad, you know, drove her to the counseling sessions and drove her to the clinic and was supportive of her in that way, he was always the one asking her, so when are you going to get your act together? Like, when are you going to stop using drugs? And in that, she didn't understand how that was unhealthy for her, because in our culture, you don't question your elders. You don't question the people that are older than you and that are giving you those things.
Thank you, guys.
Does anyone have any other questions? I think I saw something in the chat, but there's like a lot of stuff.
Some people are putting some resources. Justina, would you be able to share our PowerPoint and go to the references slides, just if anybody wants to check out our references?
Let me see what I can do. Wait, what am I doing? Can you see it now?
Yeah, it's little, guys, but see, these are some of, almost 2 pages, but this will be
Do you want me to show
some
both?
good ones. Well, we maybe leave this one up for a minute. So Bowlby, of course, is going to be like the quintessential reading if you're interested in just attachment in general. The Fraley article, I think that was just a brief overview of adult attachment. What other thoughts or questions do we have, being mindful of the fact that we just have a few minutes left? see in the chat some great avenues for future research as far as what does trauma look like in various cultures. How can we help children? How can we help children who do not use words to communicate? So for that question, I would go to a presentation that I was a part of earlier and encourage you to check out creative counseling approaches. So whether it's art, music, dance, some kind of creative approach is good for children or clients in general who struggle with verbal communication. The Harwood citation, curious about the gender differences in child and adult in attachment expression and relations. Yep. You want to go to the next page of references too, maybe? The SAMHSA article, it's always, SAMHSA is just a great resource. I think, it was brought up earlier in this presentation, I think just by someone in the chat, about the study. So if anyone is not familiar with that, that's the Adverse Childhood Experiences Study. And that's also quintessential reading about childhood trauma.
We can also send you the PowerPoint if you want it, because I think we're sending them to Dr. Hudson, right, Jen?
And we're also recording these, and they'll be in our CMHC YouTube channel, and you can always check those out. All right, yeah, we'll have those available as well. Did I come across the dynamic maturation model of attachment? If so, I don't remember it by that name. Linda asked, do you have any comments or thoughts about gender differences? So is your question about how males or females experience trauma? Or about how they respond to the trauma with attachment. We know that women are more prone to certain kinds of trauma throughout their lifetime. Oh, how they respond. Yeah. So again, like if women are more more prone to sexual violence and domestic violence, they might be the ones in relationships who are more likely to make the excuses for the partner to reduce that cognitive dissonance. Oh, great. Someone's answering the question in the chat. Boys are more likely to have externalizing behaviors. Yes, that's true. The externalizing behaviors being more like hyperarousal, girls to have more internalized dissociative symptoms. And while you're finishing up, if anyone has just general questions about the virtual conference, I really appreciate you guys all being here. I believe next is the keynote speaker.
Mm-hmm.
And, we hope we get a big turnout for him. And we appreciate all of you guys being here. Like Ashley put in the chat, or not Ashley, Hannah, I kind of put in the chat, make sure at some point you do the survey for the CEs. Don't have to do it right now. It's on the last page of the program. And yeah, thank you guys for being here. We appreciate it.
All right, thank you, Jennifer and Justina.
Thank you for
coming.
And
do you want to mention Tavera, Hannah?
Yeah, I forgot about that. Let me pull that up.
It's okay if you don't have. I don't even have it handy either. But
I have it.
Yeah. So we're sponsored by Tavera. Tavera is a platform for online classwork, online record keeping and record keeping of internship hours. So if your program needs to go online now, which many do, Avera is the resource that you need.
All right, I'm gonna stop recording.
Thank you guys. I'm gonna hop out too. Thank you.